as you continue to hold the walker with the other hand. Gently lower to sitting. Another method of sitting, if all four limbs are fairly strong, is to reach back with both hands for the armrests of the wheelchair and then lower to sitting. Ask your healthcare professional which method is best for you. It is important that your family member function at the highest level of independence that is safe for him. In this way, he will maintain his dignity, strength, and self-respect, which will aid in keeping him active and interested in life. We will now address some of the issues of independence. A routine is helpful and structures the environment. It is recommended that grooming and hygiene tasks be completed in the morning so that your family member will be awake and ready for any daily activity. We will begin with the hair. Short hair is easy to comb, but you may need to remind the person to comb the back of the head. Long hair can be kept in place with a headband. If one arm is weak, brushing your teeth can be difficult. One suggestion is to unscrew the toothpaste by holding the tube with 3 fingers, using the thumb and index finger to screw and unscrew the cap. Now squeeze out a small amount of toothpaste. Pass the toothbrush over the toothpaste so that it adheres to the brush. Turn the water on and proceed to brush your teeth. Another technique is to stabilize the toothpaste by placing it gently between your knees, using your free hand to unscrew the cap. To clean your fingernails, use a one-handed brush. To wash the unaffected or strong hand, simply hook the brush in the affected hand and move the stronger hand back and forth over the brush. Now, switch the brush to the strong hand and wash the weak hand. A compact can be attached at its base to the surface of the bathroom counter by using Scotch tape, making it easier to open and apply makeup. Lipstick can be turned in and out by gripping the base with 3 fingers and rotating the tube with the thumb and index finger. For women with some type of impairment involving an arm or hand, putting on a bra, especially a back-fastening bra, can be a trying and fatiguing process. We will first address the procedure for securing a back-fastening bra and then a front-fastening bra. First, place the bra around your waist with the back in front and fasten it. You may need to ask for help in achieving this step. Now, turn the bra around into the proper position, using the strong hand to pull it around your waist. When the bra is in the correct position, use the strong hand to place the weak hand inside the strap on the weak side. Pull the strap up the weak arm. Now, insert the strong hand inside the other strap and pull the strap up the strong arm to the shoulder. Adjust the bra. Tighten the straps if necessary. To take off the bra, reverse the process. First, remove the strap on the strong side. Then, remove the strap on the weak side. Now, turn the bra around so that it fastens in front and unhook the bra with the strong hand or ask for help. To make this process easier, we suggest you consider using a front fastening bra. Place the bra around and behind you so that it opens in the front. Using the strong hand, fasten the bra or ask for help. Use the strong hand to place the weak hand inside the strap on the weak side. Pull up the strap on the weak side. Then insert the strong arm into the strap on the strong side and pull it up. Adjust the bra. To take off the bra, reverse the process. Lower the strap on the strong side first, and then lower the strap on the weak side. Unfasten the bra with the strong hand or ask for help. Putting on a shirt, pants, socks, and shoes can be especially frustrating. To put on a pullover shirt, place the shirt in your lap with the back up and the neck away from you. With your strong hand, gather up the back of the shirt to expose the armhole for the weak hand. With the strong hand, lift the weaker hand and place it through the armhole. Pull the sleeve over the weak hand until it is exposed. Next, place the strong hand through the other sleeve up to the elbow. Push the sleeve above the elbow on the weaker side using the stronger hand. Then, bring the strong arm forward, bending the elbow to work the sleeve up the arm. Open the neck of the shirt with the strong hand and pull it over your head. Pull the shirt down in back and front. To remove a pullover shirt, pull up on the back and front until you can lift it over your head. Work the strong arm out of the sleeve. Using the strong hand, pull the sleeve off the weak arm and hand. If the shirt opens down the front, place it in your lap inside up with the collar away from you. With a strong hand, expose the armhole for the weak arm and place the weak arm in it. Pull the sleeve over the weak hand. Grasp the shirt at the collar and pull the sleeve up to the involved shoulder. Reach around behind your neck and grasp the shirt collar. Follow around the collar with your hand, bringing the shirt to the other side. Insert your strong arm. Straighten the shirt and button it or ask for help. To take off a front opening shirt after it has been unbuttoned, grasp the middle of the front edge of the shirt on your strong side and pull it out to the side so that it comes off your strong shoulder. Now, work your strong arm out of the sleeve. Using your strong hand, push the shirt off your weak shoulder. Grasp the cuff of the shirt on the weak arm and pull the sleeve off. To put on socks, cross the weak leg over the strong leg using the strong hand. The weak foot should be free and in easy reach of the strong hand. Using the strong hand, hold the sock at the front of the opening and pull it over the weak foot. Place the weak foot on the floor. Now, cross the strong leg over the weak leg so that the strong foot is free and in easy reach of the strong hand. Using your strong hand, pull the other sock over the strong foot in the same manner. If you have special precautions pertaining to bending the hips or legs, ask your healthcare professional for help. It is easier to put on trousers when the waist is elastic. To begin, use the uninvolved or strong hand to grasp the involved leg. Lift it and cross it over the strong leg. Pick up the trousers at the waist. Place the trousers on your lap with the front up and the legs toward the floor. Using the strong hand, gather up part of the leg of the trouser so that you can begin to pull the trouser leg up over the weak foot. Now, place your weak foot on the floor and put your strong foot into the other trouser leg, pulling the trousers well up over your knees. Next, put on your shoes. Shoes with non-slip soles are best. You may want to use a long-handled shoehorn to help in putting on your shoes. Velcro fasteners eliminate problems with tying laces. Another alternative to consider is elastic shoelaces. If your balance is good, you can now stand up and pull up the trousers on the good side first. To put on trousers that open in the front, first place your weak leg across your strong leg. Pick up the trousers at the waist, checking to see that they are open. Place the trousers on your lap with the front up and the legs toward the floor. Grasp the trousers at the bottom of the front opening and toss them down toward the weak foot. Pull the trouser leg up over the weak foot. Place the weak foot on the floor using your strong hand. Place your strong foot into the other trouser leg and pull the trousers up well over your knees. Put on your shoes. Remember, a long-handled shoehorn and Velcro fasteners are helpful. Shoes with non-slip soles are essential for safety. If you have bending precautions, ask your healthcare professional for specific dressing techniques. If your balance is poor, lie down to pull up your trousers. Lift your hips by flexing your strong knee and pushing your strong foot into the bed. If you cannot raise your hips off the bed, roll from side to side. Fasten your trousers. If your balance is poor and you need help in standing, your caregiver can use a gait belt to assist you. Once up, your caregiver can aid in lifting your trousers on the strong side first and then the weak. Fasten your trousers and return to sitting. In summary, the general rule to remember in dressing is: dress the weak limb first and then the strong limb. To undress, reverse the process. Undress the strong limb first and then the weak limb. Eating is usually regarded as a pleasant daily activity, but it can present some serious and life-threatening concerns. If you notice your loved one coughing more during meals, especially when drinking water, having increased difficulty chewing, slurring his speech, drooling, or consistently losing weight, a swallowing problem may be present. Check with your healthcare professional for further evaluation. your healthcare professional can help determine correct food consistencies, positioning techniques, and appropriate treatment for these problems. To increase safety while eating, especially with the elderly, a few general feeding precautions may be followed. Again, for procedures to use with a specific problem, consult your healthcare professional. A piece of non-adhesive grip liner under the place setting will keep dishes from sliding during the meal. Sit at 90 degrees for all meals and remain at 90 degrees for 1/2 hour after every meal. A long bib is helpful in keeping clothes clean. Take small bites, 1/3 to 1/2 teaspoon. Take small sips of liquid. No gulping. Do not use a straw if coughing commonly occurs when drinking liquid, or if a swallowing problem is suspected. A chin tuck position before the swallow may be helpful if a problem is suspected. Alternate solids with liquids. No more than 2 to 3 bites of food, followed by a sip of liquid. A throat clear or dry swallow after every 2 to 3 bites will help clear the throat and may decrease the chance of choking. If your family member cannot get out of bed, he should be positioned as close to 90 degrees as possible for each meal and remain upright for 1/2 hour after meals. All other feeding precautions also apply. The same rules must again be followed if your loved one must be spoon-fed. Remember to especially be careful of bite size and the amount of liquid you present. It is important to be patient and not rush the person. He should be allowed 30 to 45 minutes to eat a meal before the food is taken away. It is also recommended that caregivers be trained in CPR. Before we proceed to our next section, we will review the basic rules of safety for eating. 1. Sit at 90 degrees for all meals. 2. Remain at 90 degrees for 1/2 hour after every meal. 3. Take small bites, 1/3 to 1/2 teaspoon. 4. Small sips of liquid. No straws if a problem is suspected. 5. Alternate solid foods with liquids. No more than 2 to 3 bites of food before taking a sip of liquid. 6. A chin tuck position may be helpful if a problem is suspected. 7. A throat clear or double swallow after every 2 to 3 bites helps to decrease the chance of choking. The importance of communication cannot be overemphasized. In order to convey ideas, thoughts, feelings, or opinions to one another, we must be able to communicate. Communication is more than just language and speech. It involves a system of signs, signals, and symbols, which are expressed consciously or unconsciously. This will become clearer as we address methods of imparting information when there is a communication problem. Communication has been stressed throughout this presentation. Letting your loved one know what you will be doing to, with, and for him is of the utmost importance. Good communication skills aid in maintaining the safety and dignity of both the caregiver and the caretaker. It results in a sense of trust and cooperation between both parties. However, it can be one of the most frustrating tasks of a caregiver. You will now see how the use of a few basic rules can help decrease the stress of communication and at the same time aid in understanding. First, it is important to reduce the noise in the room. If the TV or radio is on, turn them off, or at least turn the volume down. Get the attention of the person to whom you are speaking. A gentle touch on the arm is usually sufficient. Face the person to whom you are speaking and use gestures. It helps if the person can watch your mouth as well as your facial and body expressions. Use a quiet, slow way of speaking to reduce agitation and to improve communication. Try to avoid open-ended questions. Give 2 choices. Sometimes writing down the choices is helpful. Watch for comprehension and confusion. Use short words and sentences and simple grammar. State your ideas in different ways. Be specific. A calendar may be kept in a prominent place in the home and used on a daily basis to keep your family member oriented to date and time. Use the calendar to indicate important events, such as appointments or birthdays, so that he begins to use the calendar as a reference when he forgets. A familiar routine is helpful and comforting to the person who is easily confused. Encourage your family member to tell you what he is doing step by step when he is performing a task. This helps him maintain focus and aids in both safety and understanding. Remind him of what he has said so that he feels he has control of the conversation. Do not change the topic quickly. Above all, remember, always take time to show you are listening. The basic communication tips you have just learned can be remembered by recalling how important it is to listen. L. Limit. Limit the noise in the room so that you can communicate without distraction. Get the attention of the person to whom you are speaking. Face the person to whom you are speaking. Establish eye contact if possible. Do not use open-ended questions. Limit the number of choices to 2 for easy clarification. I. Initiate. Initiate a variety of ways to communicate, such as gestures and writing. S. Speak. Speak in a quiet voice and slow the rate of your speaking to reduce agitation and increase understanding. Use short words and sentences. State your ideas simply and be specific. Phrase your ideas in different ways. Restating and rephrasing a thought helps in understanding. T. Time. Time is a confusing concept for many older adults. Use a calendar for orientation and as a reference for special events. A familiar routine is comforting to someone who is confused. E. Encourage. Encourage your family member to verbally sequence the steps of the task he is performing for improved attention and safety. Repeat what your family member has said in order to help him feel that he has control of the conversation. N. Notify. Notify your loved one when the subject is changing. Do not change the subject quickly. Sometimes it is hard for a person to switch topics. If they do not know the subject has changed, they can become confused very easily. Above all, remember to listen, even if the words do not make sense. Your loved one is trying to communicate something he feels is important.
Thank you for your interest in learning more about caregiving. To recap, we have addressed the skills of basic body mechanics for your safety and that of your loved one in order to prevent contractures, bed sores, and pneumonia. Several different ways of positioning were demonstrated.